Okay, we have the agenda before us. Do I have a motion to approve?
So move, Morgan.
Okay.
Second by Pease.
Okay. The motion by Morgan, second by Pease to approve the agenda. All those in favor signify by saying aye.
Aye.
Aye. Those against signify by saying nay. Okay, the agenda is approved. So, well, first item is discuss and or act on third amended resolution to implement COVID-19 emergency management plan. As you noticed there, I had the date of September 30th put on there. I know we were talking about a month, but if we get it on the floor, I can explain the date. If we get the motion to approve.
I'll move to approve Hickathir.
Okay. Motion by Hickathir. Do we have a second?
I'll second.
Okay. Second by Pease. Okay. We have the resolution on the floor. In looking at this and talking with Mindy and Cynthia on it, and looking at the date, we were talking about only 1 month. But as we move forward with this and we looked at it, some of the items in the plan in the emergency portion of it does include reimbursement on COVID leave up through September 30th. So that's one reason for extending it out to the 30th. Another possible reason on having it to the 30th is that the building remodeling is still taking place and won't be totally done. So portions of the plan, with having telework done, might have to be extended up until that time. That's covered in that. So that's the reason for the 30th on here.
John, isn't there other ways to address those issues?
For the reimbursement, probably not, because it's in the plan, unless you're going to revise the employee handbook.
Well, at what point? See, I've yet to see anything that says we're going to or would be in favor of abolishing the mask mandate. And that's if it's not in the handbook, then it's in the policy. Is that correct?
It's in that plan. It's in the plan that's been, always been there behind this policy that has always, come forward from the county manager that has been there. And we can go through the plan, and, the plan talks about the use of masks and yet non-use of masks on there, if you read through the plan. And that you don't have to wear masks if you can socially distance and if you've been vaccinated. So,
but that's not coming across with our employees then, because there is absolute resistance to wanting to wear those masks. And I don't think we should be forcing them to do that, not at this point in time.
Yeah, and I think we can discuss that and go through the plan if you want to go through the plan. Right now, the current, resolution allows the county manager to set that, and it's in the current plan right now. So, but this resolution just says there is the plan, like there always has been.
But yes. These employees have been mandated to wear a mask.
Yes.
Correct, until the plan is changed, and the plan hasn't been changed yet. But the plan you're seeing and the plan before was just changed by the manager, and we can go through the plan if we can get there,
John, can I mention something?
Yes.
And I hear what Bob's saying, but the plan has never been based on whether it's popular or not. I think the idea was that it was based on what is good practice and based on what the public health officer had recommended at the time. So whether it's popular or not popular, it's about protection, I thought, is the whole idea. And if we extend it to September 30th, it doesn't mean that we can't rescind it next month.
Well, no, and the plan can change, and the plan can change next week. I mean, right. The plan can change, and the plan, and I think if we, so really the resolution just says that there will be a plan, and the plan has those items in it, and we can, the plan, and now the current one, if you move down a little bit, Cheryl, or pull that up, I can't see all of it right now. The only thing we were changing, we're changing the strikeout there, you can see, is that, before it was actually, just the county manager, administrative coordinator would put the plan together with public health and then with my oversight, because we had to move fast. But now, after last week, decided to have the approval of the admin and finance committee. The county administrator would still, be authorizes and would coordinate that. But then, the way that it is currently right now, we can meet quicker with Zoom calls, just like this. So we can normally move probably ahead. So, it gives us, the board's always had oversight in the plan because, we're the policy setting body of the county. So, and moving that out of there a little bit. So,
John, I'm not opposed to, there's a lot of good points regarding the plan. There's some points that, we can talk about, we can rescind this anytime, and yet we've yet to propose to rescind anything. And at some point, we have to own up to the fact that things have changed since this whole pandemic started. And it's high time to give their people their choices. And I'm in favor of the Zoom meetings as much as I don't like them. At least, there's some positive things for that, and I understand that. But we need to get off from top dead center here and make like we're actually admitting to the fact that this thing is narrowing down, and the people that have gotten their shots and they're available and they can get them anytime they want them pretty much now. And those that have chosen not to get them, it's not up to us to change their mind. So I think it's time to move on. And if we can do that via policy, I want to do that.
Right. And I think as we go through this, you'll see that it is moving, so and part of it is, going through these steps. I think you'll see that, and we'll go through, the next item to talk about is the plan, and we'll see how the plan, we can go through the plan, and it can be explained how the plan is changing and the reasons for change and meeting, some of the guidelines on that. So, but this policy does not actually change those things. The plan is actually what addresses those things.
But this is like the meeting the other day. We're going to vote on a resolution before we discuss factors that would make it more advantageous or not.
Well, we can discuss the plan if you want, but.
Well, for me to vote in favor of this resolution, I would like to know where the plan will be standing.
Okay. So if there's no opposition, we'll just set this aside for right now?
I'd be in favor of that.
Okay. Hearing no
Mr.
opposition.
Chairman,
then,
this is Rick Pease.
Yes.
I agree with Mr. Goparski that we should set this aside and look at the plan first.
Okay.
I have a lot of the same concerns that he currently has, so I would like to look at the plan before I vote on the resolution.
Okay. So we'll set this aside and move on to the amendments to the COVID-19 plan.
Do you want the marked up copy on the screen or the other copy? I'm not sure.
Let's do the marked up.
And I know,
Oh, good.
Mindy's on there, and if either Kelly or Leah, if they're on there, if you can give your input also too as we go through this, that'd be greatly appreciated.
Well, I guess I'll take the lead.
Okay, thank you.
One of the things that was done was, you'll see there's lots of marks because we redid the formatting because it was difficult to determine which section you were talking about. So we redid the numbering, so that'll make it easier for everyone. But if you look at the first page, the only change is in section 2.03. You'd scroll down on the screen to eliminate COVID-19 is a new disease and the CDC is learning about how it spread, the severity of illnesses it causes, and to what extent it may spread in the United States. Currently, the virus is thought to spread. It updates that section. The disease has been here for a year. It's no longer new. The CDC knows how it's spread. So that was Leah's recommendation to take out that sentence and just say COVID-19 is spread mainly from person to person as follows, and then explains close contact, respiratory droplets, and then there's no changes. It just describes the method in which COVID can be spread. Then the next change is on section, what is now 402. And that is a change that Leah added, and it's just to make people aware that COVID has been able to mutate to and with 5 notable variants in the United States at this time, with some being known to cause more severe illness and spread more easily than the original virus. And that ties into some of the continuing recommendations. And Kelly can jump on if she wants to, but the concern is that COVID's still in the community, and there's still these variants that are out there. And they're at higher risk, they spread faster. So you have to be prepared to respond to those variants if they come into the community. Kelly, do you want to make any comments?
I would just agree with you, and to just also point out that Leah is not able to join us today. So I think Mindy and I will do the best we can to explain Leah's point of view.
Okay. So is there any questions, concerns just about those updates to the plan? It's informational. Okay, you go down to paragraph 4, risk and complications. Deleted some information, early information on out of China where COVID first started shows that this has been updated. We don't need that sentence, but this lists, as we have learned more about COVID-19, the impact that it has on individuals who contract the virus. And this is information from CDC. Okay, the next change is what becomes new paragraph 5 shows up on your screen as 3, limiting risk / non-pharmaceutical interventions. Previously, the sentence read that the first line of defense to help slow the spread of COVID-19 before a vaccine is available and to cease the burden on health care workers include the following. Well, we do have a vaccine now, so that sentence needed to be updated. But the first line of defense to prevent the spread is, and this lists all the safety precautions. Again, it's just an update. Stay home when sick, cover coughs and sneezes, wash your hands, use sanitizer. None of that has changed. Section 507, wearing a face mask, covering, or disposable mask when appropriate. And then it references see COVID-19 PPE below. And that's where that provision has been changed and loosened somewhat to reflect people that have been vaccinated. These recommendations and requirements are still on OSHA's website. OSHA still requires these safeguards in terms of staying home when you're sick, sanitizing, surfaces. The only thing that has changed is the guidance as to vaccinated individuals.
Mindy, so 5.07 talks
Yes.
about the mask,
Yes,
and it makes reference to COVID-19 below.
Yep.
And I just went to 19, and that has to do with travel. So
no, it's
what
not
am I
number,
missing?
it's not number 19.
Okay.
And we can cross-reference the sections, but there is a section called COVID-19 personal protection, and it's paragraph 22.
2.
Yeah. So that's where we'll be spending most of our time, is the discussions about section 22 and 23.
All right. Let's get to it.
All right. The other changes in that section are just minor. Again, it used to say avoiding non-essential large gatherings of 10 or more, because that was the guidance that came out of the state. We don't have that 10 or more limitation. So again, these are updates to just be consistent. The next section, response coordination, the numbers has changed, but that continues. That there's a coordination between state, federal, and local government, an obligation or response to distribute information, provide recommendations. This is what Leah's been doing. Again, making recommendations on that policy to the county manager. Communication protocol, the only change in that section was to give a new link to the CDC website for additional information. The next section, cleaning and disinfecting, which is paragraph 8. There's an update there in what is now 803, and that is just a better description of the cleaning products that should be used. Instead of EPA-approved emerging viral pathogens, it's EPA-approved pathogen-containing labels. I mean, it's just a little rephrase of the same thing. All right. The next change, and again, the rest of this section is just about how to do the cleaning in the offices to maintain a clean work surface. And that continues because you're going to have people that are unvaccinated and still need that protection. And you have people who are vaccinated who still have a risk, though it be very slight, and may have a greater risk to a variant because we don't know some of those variants out there. All right, so that brings us to what is now paragraph 9. And let me stop right there. Any questions on disinfecting and cleaning? Anybody thinks we should stop doing that? Okay.
This is Jody Shapey. Is there any way I could ask a question?
Sure.
Okay, if we back up a little bit, underneath the CDC guidance, was that a must wear or was that a should wear a mask if they're not vaccinated?
We will be talking about that later, but it's going to be a must. At least that's the recommendation.
Is that what it is, Mindy, on the CDC guidance on the website?
I'll pull it up.
I guess I'm a little. I want to make sure that we have the right understanding. If it's a must, fine. If it's a should, then I think we need to consider it. And now I will mute myself. Thank you.
All right. Let me grab that wording. Okay. All right, I'm going to have to pull up the language. My computer's being slow, so. The way the CDC words it is if you are fully vaccinated, you can resume activities you did prior to pandemic. Fully vaccinated people can resume activities without wearing a mask, except where required by federal, state, and local. So if fully vaccinated people can resume without wearing a mask, people who are not vaccinated need to wear a mask.
Now, you just said Fed, state, and local, so that still means that we have to address this. Because
some counties had a mask mandate. Adams County did not have a mask mandate, except as it related to its employees. It may have had a recommendation, but you never issued an order. For example, in Eau Claire City and Eau Claire County had a mandatory mask mandate for all residents if they were inside. And that trumped when the state lifted the statewide mandate, that local mandate trumped and was applicable to everyone. Adams County never implemented a state or a local mandate for masks, but each employer has to consider the risks for its employees. And when it talks about federal, state, local, tribal, territory laws, rules, or other regulations, including local business and workplace guidance. An example of a federal law is the TSA requirement that everyone wear masks on airlines. Employees have to do that. We all have to do that. We have to follow that whether you're vaccinated or not.
Mindy, I don't mean to interrupt, but
yeah,
my concern is what we're dealing with and Adams County employees,
right,
and the courthouse and so forth. What the other businesses do, I mean, they can follow the state guideline. That's fine. If they don't want to have a mask and they've never been mandated, fine. But right now, we've been mandated in our courthouse that everyone has to wear a mask with some exceptions. So we need to get that addressed and get it over with.
Yep. And we're getting there in terms of the policy, and we'll get down to that. I'm just explaining the framework. Eau Claire County and the Eau Claire City did remove their mask mandate. So it's up to the local businesses to decide. OSHA guidance defers to the CDC. And the CDC is saying if you're not vaccinated, you need to wear a mask. You should wear a mask.
Actually, Mindy, and this is Jody again, just because I'm devil's in the details. Actually, it's not saying that. It's saying if you're vaccinated, you can get rid of the mask.
Right.
But it's really not saying explicitly. On the other hand, if you're not vaccinated, you need to wear the mask. I mean, you can imply it, but it's not explicit. So I guess I just question the, hey, it's black and white when I don't think it is.
May I speak?
I mute myself.
Can you guys hear me?
I don't know who just asked to speak.
Me, Cynthia.
Oh.
Sorry, I thought you guys could see me. If I could interject something.
Yeah.
Okay, I'm looking at CDC's. I guess it's a release April 1921, and the second bullet point here says a mask is not a substitute for social distancing. Masks should still be worn in addition to staying 6 feet. So that to me is an update that says the word should. And so that backs up what Mindy is indicating.
Right. There's two sections. Masks should be worn.
Mm-hmm.
But
Now,
it doesn't
CDC,
must.
let me back up. CDC is not the law.
Mm-hmm.
CDC cannot mandate that everyone wear masks. They issue recommendations and guidelines. And that is what public health follows. That in order to keep employees safe and the public safe, individuals should wear masks.
And Mindy, if I can again, this is Cynthia. So my understanding, and this is the words, should is a recommendation, shall is more of a mandate. Is that correct?
And CDC does not have the authority to mandate.
Okay.
And that's why they use should. And let me give you the range. I can tell you what the law is, and you can decide how you follow it and what the policy considerations are. There is a gambit on how counties are interpreting this. Some are posting signs that if you are not vaccinated, you must wear a mask. Without stringent policing requirements, just you must wear a mask. Some counties are a little softer and say anyone who is not vaccinated should wear a mask, or anyone who is not vaccinated, please wear a mask.
Mindy, it's Pete Hicketh here. Can I ask a question?
Uh-huh.
So basically, in those counties, we're going on the honor system.
Yes.
That'll work.
Yeah, and here's the concern. The concern is you have an employee who is unvaccinated, cannot get the vaccine, and it's a free-for-all in the office, and they're wearing their masks, but they may be exposed. They may not be able to social distance, and you are going to get a complaint, and the state is going to come in and investigate to see if you are providing a safe work environment for your employees and that particular employee. So that's the risk. Okay, well, let's and I know Cynthia's gathered some input from some department head, but let's get farther down through the policy before we act, and I can actually explain the mask recommendations that were put in. This next section, quarantine, sick leave, and emergency leave. This is a new benefit that was available to governments beginning April 1st, which allows you to take a tax deduction against payroll taxes if someone has to be out because they're being quarantined or they're experiencing COVID and seeking a medical diagnosis, or, and the new part is, an employee is receiving COVID-19 vaccine or recovering from the vaccine. Early on in the pandemic, these leaves were required for non-essential employees to be paid leave, but there was no reimbursement through a program like there is now. In your old program, you allowed certain groups of employees to receive COVID paid leave upon the manager's approval. There hadn't been a lot of use of that, but going forward, just through that limited period of September 30th, if somebody has to be out because they have COVID, the county can pay them and you'll get reimbursed for that. If somebody has a reaction to a COVID shot and needs to be out, you can reimburse them for it. This is optional. You don't have to do this. You could eliminate this whole section, but it is a paid benefit that costs you nothing, that may give an incentive for some folks to get the vaccine if they know they can get paid time off to get the vaccine and to recover the vaccine and not have to use their PTO. So are there any discussions on whether you want this provision in there or take it out?
What's permissible for documenting those types of things?
The IRS has given some guidance on what to include in terms of the documentation.
So am I to interpret that documenting that for reimbursement would not be a problem?
No, it would not be a problem.
Normally what you do is you set up like a pay code, Bob. That's what we did here at Adams Columbia. So I assume that they would do something there too.
Jody Shapey, can I ask another question?
Sure.
Yes.
I'm just curious, if someone is in one of those high risk categories and cannot do the vaccine, are we addressing the use of therapeutics such as ivermectin or hydrochloroquine when it comes to quarantining and whatever nodding? I mean,
No.
you mentioned therapeutics way back, and I'm just so that would not be a reimbursable thing.
No.
Okay.
This strictly has to do with allowing an individual who needs to be off because they have COVID or they're quarantining to be paid their wages.
Okay, thank you.
Pete, you were thinking out loud. You're unmuted.
I didn't say anything, Bob. Here's my question, and maybe it's a question for Mindy, but maybe it's a question for Kelly. First of all, anytime you have a mask thing with an honor system, that means nobody's wearing a mask. The other thing that concerns me is that you don't wear a mask just to protect yourself. You wear a mask to protect somebody else. Is that right, Kelly, or am I wrong?
That's correct. The reason you wear a mask is to protect someone else, not to protect yourself.
Thanks.
All right. So are there any thoughts on this leave provision?
So if you're waiting for input, Mindy, there's no reason not to leave it in there, is there?
Not that I see, no. It's optional. It doesn't cost you anything.
All right, then let's move on, as far as I'm concerned.
All right, the next section is paragraph 10, employees who have been tested, diagnosed, or come into contact with somebody with COVID. Under section 10.1, there's a new section, and this is out of the CDC guidelines, is that if you are fully vaccinated and you come into contact with somebody who has COVID, you do not need to quarantine unless you're showing symptoms or you work in the jail. If somebody in the jail, regardless of whether they've been vaccinated, is exposed to someone with COVID, they have to quarantine. But if I, for example, come into contact with somebody who had COVID, no need for me to quarantine unless I start showing symptoms, because the chance that I would get it are remote, but there's heightened requirements in a jail environment. There's also additional provisions for healthcare, but that doesn't apply to the county. All right, so again, that's just an update based on the latest from CDC. The next change is under 10.2. Have you been diagnosed? It's just a repeat of that, or the next section, have you had a close contact with somebody who's been diagnosed? It's just a repeat of that. So just an update.
Mindy, my time is going to be limited here. Can we step it up if possible, please?
We're almost there. Okay. Exclusion from employment, no changes. The next page, there's a paragraph 12. That sentence was just moved. Telework, the next section, that has not been changed. It's still available. No changes to that. You go on to paragraph 16, social distancing. The only thing that has been done there is just to make things consistent. When you need to maintain social distance and wear a mask, and it just refers to that other section. The next section, travel restrictions. That section has been eliminated because we are not in a situation where you need to notify public health if you're go on a trip. So we've just referenced CDC guidance, just check with CDC, but we don't have all those restrictions anymore, and that section's been taken out. Again, if you travel, how to protect yourself on a trip, it's just been updated. Again, to note that if you are traveling and you're fully vaccinated, you don't have to wear your mask unless you're required to in the area that you're going to. Domestic and international travel, again, have taken out all the specifics and just referenced if you're going to travel, check CDC guidelines on international travel. And then, as with any, if you're traveling and you come back to work, monitor for COVID-19 symptoms. All right, now you get into the meat, which is the COVID-19 personal protective equipment. The first part of that has not been changed, just recognizes that it's the county's obligation to provide personal protective equipment. In addition to personal protective equipment, the county has to have those other administrative controls in place, the hand washing and the sanitizing. 22.4 just gives guidance on how to maintain your masks. Requesting and use of PPE. There are some minor changes just because we talked about cloth face coverings or disposable masks, and we just went through and made the wording consistent. But it does say all county employees, officials, contractors shall wear PPE at a minimum cloth face coverings or disposable masks when working with the public or whenever in public places, public areas of all county-owned vehicles or facilities, exceptions will be allowed for fully vaccinated individuals or based on medical necessity as set forth below. So the next section provides that, and this hasn't changed, that if you're outside, if you're in your own office and you're working alone, you can take off your mask. If you are outdoors, you need to social distance, but you can still take off your mask. Employees, the next paragraph just describes how to properly wear a face covering and what is an acceptable face covering. If you are required to wear a face mask, you can remove it when you're eating. Mask may be removed if you're having problems communicating with someone so that they can hear you. Law enforcement is exempt from wearing a mask where it creates a risk to public safety. Jail staff must continue to follow department protocol. So law enforcement is going to have their own set of rules. They've had their own set of rules And there may be circumstances when law enforcement doesn't wear masks. And the policy does allow departments to establish their own rules if they want employees to wear masks in certain circumstances. Paragraph 23.6 is the ADA provision. Employees, if employees have a medical reason they can't wear a face covering, they are privately to let HR know. And then HR can take the appropriate accommodation to protect that individual. And there have been some situations in Adams County where individuals have met with Michelle, where they've had a medical reason they can't wear a mask, and where some accommodations have been made with barriers, social distancing, etc., to protect that individual. And then the individual is only required to wear the mask for very short periods of time when they're moving from one location to another. But it's been very confidential, and to the extent it can be, and has been documented in their files. Okay, the next is the policing provision. Fully vaccinated employees must provide a copy of their vaccination card or print out of the pertinent areas of their vaccination record to HR to be exempted from wearing a mask. And then that documentation is kept in the employee's confidential medical record. It is not, and I know there's a lot of misconceptions, it is not a violation of HIPAA or any other law to ask an individual what their vaccination status is. It is not considered a medical record. In terms of providing a vaccination card, some employees, some individuals have just taken a picture of their vaccination card and have put it on their phone. And just by the way of an illustration, my son lives in Eugene, Oregon. He went to go to a nightclub. They did vaccination carding at the door. And if you could prove you had a vaccination, they gave the individuals a wristband and they didn't have to wear their masks. But they're very vigilant in Oregon. They've had a big outbreak among their college and younger adults. If you don't have a card, you can go on the Wisconsin Immunization Registry, and it lists all the vaccines that have been administered to you in the state of Wisconsin. It's easy to access. You just show the first two lines, redact the rest, and it's easy to do. And here's the meat of it. If you're fully vaccinated, you would not be required to wear face masks unless, and there's numbered paragraphs, they're engaged in face-to-face interactions with a member of the public. The reason to do that is you're not going to, and I assume you're not going to require individuals that enter the courthouse to show their vaccination card and wear a mask or not wear a mask. So this provides a level of protection to the employee and also to the member of the public that they wear a mask. Now, some cases you have barricades and it's not necessary, but if they're one-on-one, they can't social distance. This provides a level of protection for the public and even for the vaccinated employee. If they're in a common area where members of the public may be present, throw on your mask when you're in the restroom, again, because somebody's coming into the courthouse, you don't know what their vaccination status is. If you're meeting with others in offices or conference rooms where all the participants may not be vaccinated and social distancing is not possible. So, conference room meeting, if everyone's able to social distance, anyone that's vaccinated can take off their mask. If social distancing is not possible, folks should be wearing masks. And then if your department requires more stringent face covering protocols, or if you're in a county vehicle with somebody who is not fully vaccinated, everyone needs to wear a mask. Again, you're in a very small, close environment. I know of one county who has just taken the position that if they're interacting with the public, they will put on a mask if requested by the member of the public. So they've gone a little bit more lenient on that. 23.9, employees are not expected to disclose the reason they're not wearing a mask to others. You may have a combination of people that can't wear a mask for medical reasons and people that are vaccinated. So no one should assume just because they're not wearing a mask that they have been vaccinated. The other thing is that some people who are vaccinated will still choose to wear a mask because they recognize that there's still that chance that they could contract COVID-19 or a variant, even if they've been vaccinated and they choose to continue to wear a mask. So employees should recognize that. The other thing is that, let's see, just 23.11 is the stick. If somebody is not vaccinated, they don't have a medical reason why they shouldn't wear a mask, and they're not wearing their mask, and they're putting others in danger, they could be disciplined. So the brunt of your discussion is that section 23.8, 23.7. Do you want to verify people are vaccinated? And do you want to have the stringent requirement?
All right, I'll weigh in. Imagine that. We've spent a lot of time and a lot of words to say if you're vaccinated, you don't have to wear a mask. If you're not vaccinated or you got some other reason, you know, we'd recommend that you wear a mask. And the way it looks to me, it's not enforceable at any rate. I don't know who's going to enforce these types of things. I just think we've gone a long way around the barn to say a simple sentence that while we recommend or we would encourage anyone that's not vaccinated to wear a mask, that's it. Quit wearing one if you're vaccinated, be done with it. I mean, it's all over. It's not Adams County. It's not Eau Claire. It's all over. Throughout the United States, people are lifting these mandates and these mask requirements. If somebody feels comfortable wearing a mask, more power to them. But those that don't, we're not going to penalize you. We're not going to put you in jail. So what are we actually doing here?
Cynthia, may I interject something?
Yes.
Can you guys? Okay. So there is disciplinary action addressed in 23.11. It's not by the sheriff's department, but it's actually at a more of a department level. So, and it says there very clearly that someone can be disciplined for not, wearing the mask. And I believe we actually have cases where people have actually been disciplined for not wearing masks already. So just wanted to put that out there.
Fine. What does that mean?
Well, the way it stands right now, there is disciplinary action that can be taken. But that, to me, it reads as though that's at a department level. So it'd be a department head that would recognize somebody, they probably got onto someone perhaps not wearing the mask as outlined in this plan, and because they didn't adhere to the request, they ended up getting disciplined for it. So I mean, it is here. I mean, you guys can change this, but I'm not in favor, or I'm not voicing my opinion for or against. I'm just bringing out some points here before I started sharing information that I did receive from the department heads.
And I know some people have been written up, so. Oh, Rick.
You're on mute.
Supervisor Hickathar, you got on mute.
Thank you. I have a question for Kelly. Kelly, what percentage of Adams County, now Bob talks about everybody's lifting it, but the places that are lifting it dramatically have 60 to 70% of the people vaccinated. What percentage of Adams County is vaccinated?
Pete, just a quick question for you. Where are you getting this more than 50%? Because as of the news this morning, there was only like 4 states that had 50%.
Right. But for example, California is the big one. They're like way up in vaccines. But I think if Kelly, if you can, we're only like at 40%, aren't we?
37.4% of the population has completed their vaccine series. We have about 40% that have received at least 1 dose.
So 60% of the people in the county aren't vaccinated. And we're saying, oh, but let's make it optional. It doesn't make a lot of sense to me, but hey, that's just me, I guess. Thanks.
Eric, can you share what the department heads think of the mask policy?
Okay, so I didn't receive all responses back, but I got a majority of them. And as you can imagine, they want to remove the mask mandate. They're all experiencing mask fatigue, and that's understandable. There's also if the case is that we can't do away with the mask mandate, that maybe an alternative would be to require masks only during interaction with customers or citizens, that come in, who are actually wearing them out of respect. If they're wearing a mask, then we should probably follow suit. And let's see. And the telework, which is part of this plan, was favored overall. I mean, there are some departments that are not happy with it, with perceptions of maybe people not actually working when they're not here. But to me, my personal opinion is that we need to trust our department heads who oversee those areas that are teleworking, and that they are properly monitoring that process. And I did get some responses regarding the telework that good employees will be responsible, diligent, and productive, and that the work can be tracked. So there is a tracking mechanism that'll ensure that people are actually engaged and working while not here. The other thing is, if we do away with the mask mandate or do away with this plan overall, I think that was one discussion. Are we prepared to allow public to attend meetings unmasked at this point? So there's a risk there. I mean, so if we're going to say no masks for us, are we now going to have these meetings open and where the public can come in unmasked? There's the concern of a liability to the county versus employee morale. So you've got two things on the spectrum here, which one outweighs the other. And I can tell you that morale, it appears to me, is way down. It's so, I mean, something needs to be addressed, whatever that is, but whatever is decided, to me, there's the two sides of the spectrum is liability versus employee morale. What drives us more in this county? What's more important to us? And let's see. That's about it.
Thank you.
You're welcome.
Yeah, in my opinion is that, I mean, we're not doing this as a countywide thing. This is as an employer. I mean, us as the county board is sitting with our employer hat on, and how do we protect the one employee that might be vulnerable and wants everybody else to wear masks. So, I mean, you have that one person that wants that. We have to, it's just like, we have to be cognizant of that fact, so how do we make parameters on that? That's my viewpoint. So Supervisor Pease, you were going to say something?
No, I was just going to say kind of what Cynthia said here. If we do pass this, it's basically what she said. The vaccinated people don't have to wear a mask. It's be the unvaccinated that would be required to, correct?
Correct.
Unless dealing with the public.
Well, and you don't have to wear a mask if you can socially distance. If you're in your office on your own or in your cubicle and socially distance, you don't have to, or outside.
And the public is free to go without masks now, anyways, according to what Mindy said earlier.
Well, there's no requirement within the state. I mean, I would recommend that you put signs up that masks are required or recommended, or you can just use the CDC guidelines for your public and say individuals who are not vaccinated should wear masks when entering the building. But we're talking about employees and their safety.
Okay.
So how do we proceed with this? If we pass this as it's been presented, then I guess we're all good. Is the departments don't have to wear a mask if they've been vaccinated. I guess that's in a nutshell.
Or if I may, sorry, Cynthia, or if they have a medical condition.
All right, John, can we put a time limit on this? We're looking at end of September for the resolution.
Well, I mean, the time limit on this plan can be ever changed. I mean, if something changes tomorrow, the plan can come back. And before this plan was really under the county manager's, responsibility to update. So, I mean, if there's some CDC guideline that comes out tomorrow that totally takes it away, the plan would be, updated. And right now, the way the resolution is that it would come, the county manager would bring those changes to the Admin and Finance Committee, and the Admin and Finance Committee would agree to the changes, and then we'd move forward on it from there, and then it would be updated tomorrow. So, I mean, right now, without the current resolution is that the manager can update this plan, and normally works with public health and myself, and then the board is made aware of it. And that's where we are right now under the current resolution that we have that hasn't been amended yet. So,
okay. So to Cynthia, and I see Rich is on, what's the feeling? Will this suffice the departments as it's been presented here?
So I'll bring up again that most employees have the mask fatigue. I keep using that, but it's so true. They're fed up with wearing the mask, and they're thinking that it is ruining morale, not only for them as department heads, but also their staff. And then to have to keep enforcing this mask mandate is resulting in disciplinary action, which then creates more morale issues, if you will. So the way that it stands now means that we're just going to be status quo as far as the mask mandate, unless you have a medical condition, or well, except for the new point about the vaccinated personnel.
But to answer the question, if this was passed as it's been presented, does that solve the issue?
So there's two issues. One is the legal, and the other issue is morale. So
what's legal? What's the legal?
So I'll let Mindy address that, but there's a potential to be cited. There's a potential to have examiners come in here and say that we didn't provide a safe work environment if we do away with, let's say, the mask mandate. Or
we go through that all the time with OSHA, et cetera. I mean, this isn't new that someone could challenge what we've done or not done.
This is true.
To date, you have followed OSHA and CDC guidance and required everyone wear masks. That guidance has changed, saying that if you are fully vaccinated, you don't have to wear a mask. This is drafted to be consistent with that current guidelines, that if you are fully vaccinated, you don't have to wear your mask except in very limited circumstances. What I hear Cynthia saying is there are some folks who are not vaccinated who do not want to wear a mask under any circumstances.
Kelly?
Is that true?
Oh.
Go ahead.
Kelly, are you still on?
I am.
And from the public health standpoint, I mean, the public health viewpoint is to go along with the draft that we have.
Leah's requirements are to continue to push forward the guidance from the CDC, which is that those who are unvaccinated will need to continue to wear a mask while indoors.
Right. Supervisor Gabarski, you were...
Well, we can't just keep dwelling on this. And
right.
One other point that Pete brought up is the mask, does it do good for the person that's wearing it or the person that they're conversing with? And the jury's out on that. I mean, they're talking that this does not protect you by wearing a mask. And so I don't know. I've heard both ways.
So Cynthia, if I heard this correctly earlier in our discussions today, it's the mask protects others. I mean, the weight is more that it protects others and not so much yourself, is what I got today.
I think CDC has recognized that there is some protection for yourself. It does go both ways, though the heaviest leaning is it protects others.
Well, can we hear a couple other opinions? I've done all the talking, so I want to hear somebody else.
Supervisor Morgan?
I really think we should follow the CDC guidelines, and the people who are vaccinated don't have to. But I've also heard from like the extension department that one day they had to wear masks, but the only two people that were in there were Larry and Linda, and they're both married. They don't have to wear them at home. They had to wear them here.
Any
I
of the
really
other
think
super-
that's, yeah, I think it should be up to each department.
This is Supervisor Shapey. Can I ask a question?
Yes.
I know that we've been talking about liability and all that goes with it. Have we considered any kind of problems down the road where we've got more dental expenses because the masks are causing problems with teeth? The fact that people are assuming that they're being perceived as maybe I'm going to use this word loosely, kind of a segregated few that are being forced to wear masks, and maybe they are doing therapeutics, and maybe that is actually effective.
Noah's Ark in Wisconsin Dells opens this weekend.
Where do we stand? It sounds like we could CYA a lot, but
taking steps back to what
are we
should be
fully protected from liability in these various situations?
Will still be asked to wear masks when not in the water. Masks optional for everybody else.
You have a better defense
summer,
when you
water park
follow the
opened late
CDC
and closed
guidelines
early due to
than when you
COVID.
don't.
This year, they are planning on.
And the other thing that is continuously out there is the potential that if you have one employee spread it to another employee and you have not been taking these precautions, that you'll have a workers' compensation claim.
America's largest.
Okay.
This is Jerry.
Go ahead.
No, you go ahead, Jerry.
Well, I was just curious. I know that I asked Chairman West yesterday, is it possible, instead of having this plan, is it possible as a sign-off, can we have employees sign off that they're not going to seek any kind of litigation if someone should get ill or whatever?
Such a waiver would not be valid in the state of Wisconsin. You can't waive your right to workers' comp or other benefits of that nature.
Thank you.
This is Jerry Paler. I just like to ask a question.
Yes, go ahead, Jerry.
Okay, if we're so worried about liability without this mask mandate, why isn't the public sector worried about that? You can go to almost any store you want to, including Menards, Farm and Fleet, any one of them, and none of the employees or nobody's wearing a mask anymore. I don't believe any of the factories or anything like that around are mandating masks. So is liability only in the public sector?
You know, it depends on their risk avoidance. And we have a group of attorneys here in the firm that handle private sector. And they stress over and over the need of private sector employers to follow OSHA's guidelines.
John, it's Pete. Can we call the motion?
I don't think we have I don't think we even made a motion yet, so.
No.
Oh, I thought we had a motion on the floor.
Well, we had a motion on the resolution. We didn't have any motion on the amendments.
This is Supervisor Shapey. Could I ask another question?
John, we haven't heard from Rich yet. Rick. I'd kind of like to hear from him and then get to Jody.
Okay.
Yeah, this is a hard one for me. It's easy to say that we should follow the CDC guidelines, but I hear from Cynthia that the department heads really would like to go to a no mask situation. And I'm tending to lean that way because of the enforcement alone is going to be hard for all departments. And I think that eventually it's going to be, even if it's next month, we're going to do away with this mask mandate anyways. I see other counties doing similar things. So my intent is to do away with that portion. And I don't mind the rest of the COVID plan they have in place, but we'll never know all who's going to be vaccinated, who's not going to be vaccinated. And I don't think there's people out there who really want to be the vaccinated police. They want people to do their jobs. So I would rather default to having people do their jobs in lieu of losing good personnel because we can't make a decision on if they should wear a mask or not. Thanks.
Can I say something? It's Jody.
Yes, go ahead.
Okay. One, I like what Rick had to say. Two, Kelly, if you're still on, I'm on a phone, so I can't see who's on or off, but how precise can you pinpoint where someone acquired the virus?
That would be through the contact tracing, and it would depend on how much contact someone had with others to really get down to how close it was. It would also depend on the nature of the outbreak. I couldn't say with all certainty that, yes, they could pinpoint something directly to another person all the time, but they may be able to do it some of the time.
So if it's work related, you think you could pinpoint it versus I was out at lunch, I talked with so-and-so at, I don't know, Subway, whatever. And, sometime during my day, I got COVID. I'm just wondering, liability wise, how can they actually say this was a workplace event?
I think, again, it would depend on the context that that individual was having. Mindy, I don't know if you've seen anything in specifics in any of the other employment sectors related to something like this, but I think it would be on a case-by-case basis.
It's a case-by-case basis, and I am aware of a situation. I can't tell you which law enforcement department it was, but they had an officer who contracted COVID. They traced it to his work environment, and unfortunately, that individual did die of COVID. So it happens. It's rare. It's very specific in terms of the tracing.
John, this is Rick Pease. Can I ask a question?
Yes.
If because we're going around in circles here, the real question to me is, if we pass the resolution to extend till September 30th, does the plan also go to the board, or because now that we are the deciding factor, the committee will? No, the new plan would go to effect after the county board voted on a resolution, correct?
Correct. And the plan has normally just been, the county board in the past hasn't even, has been made aware of the updates of the plan. And I guess there's never been an opposition to those updates. So, until the county board meeting, the amendments are made by the county manager and accepted. So until that resolution passes, that's the resolution that's in place right now.
I guess my reason why I asked that question, because at this point, I would like to maybe pass a resolution to extend and then let it go before the full board to let them have their say also about this, and then maybe even put the plan up to a vote also. They would then have that say for a little while until we pass that resolution. I'm just thinking outside the box here. I don't see where this is going, this continued conversation.
Right. And what we could do is, if we pass the resolution, we can bring the plan forward. We can let the plan go forward as it is. And if the plan is changed, that we can, bring the plan onto the county board floor too, to make any amendments if we want to at that time then too. So, right, like you say, the full board can have their say on it and vote on it then, so.
You would, right now, the resolution is only to allow the
Admin, finance.
admin and finance to have oversight over that plan. Is your thought to have the whole county board have oversight into the COVID plan?
No, but I just wanted them to have some discussion and know what we're dealing with, so that they could have input to us, so that we could make informed decision, possibly with some of their guideline also. I do believe that the smaller number to make the decision would be better.
What, just a thought, you could approve this plan as currently amended, get the county board's input and thoughts, and then if you want to take it back a step, what you would do is take paragraph 23 and just change it to employees who are unvaccinated should wear masks unless they have a medical reason that they are unable to do so, period.
So why wouldn't we just take out section 23?
You should at least follow the CDC guidelines or recommend that employees follow the CDC guidelines. That's a very minimum approach.
Well, I could live with that, but so if we pass this plan and change section 23 to say unvaccinated employees are encouraged to wear a mask, is that legal? Could we do that?
You can do that.
Then I make that motion.
I was going to second it, but that's good.
So the motion is to amend the plan as presented to eliminate section 23 and state that all unvaccinated employees are encouraged to wear masks.
Mm-hmm.
Yeah. Effective
Yes.
today, or effective as soon as possible.
So motion by Supervisor Kubarski, second by Supervisor Morgan.
Yes.
Yes.
I have a question for Mindy.
Yeah.
Mindy, by changing this, does it increase or expose our liability to a greater degree by changing this wording and simplifying it?
It does. And it's up to the county on how much risk they want to take.
So we're basically saying we're not following the CDC guideline. We're going to make our own rule, but by not following the CDC guideline at this point, it would increase our liability.
It increases the liability. I mean, this is an option that you have.
No sense.
That all unvaccinated employees are encouraged to wear masks. And you could even
But
say,
isn't that the CDC guideline?
Pursuant to, they say should.
Oh,
Should
okay.
gives you the authority, gives you the language to enforce and say CDC should, we are saying you have to. This is saying CDC said you should, but we are just saying we'd be happy if you did, basically. So it is, if you are saying no masks versus unvaccinated masks in a spectrum, this is here as opposed to here. It's better than nothing.
Okay, Cynthia, I have a point of order. I guess I don't know if that's the proper lingo, but so I'm looking at section 23 again. And if we're going to try to line this up with CDC, the way that this reads, it's almost like a mandate that it's not a shall. And that's what CDC is saying. They say should. They say it should. But the way that this 23 section reads to me is more of a shall. It's given a absolute, like all employees are to do this instead of doing the should, which would then line up with CDC. That's just my opinion.
Right. Because CDC does not have the authority to tell you that you have to. They say what you should do for your employees. And that's why in the earlier versions, the should was shall.
Remember, even though if we would vote this in place, we would, it would not take effect until Tuesday when we would pass a resolution, correct?
No,
it could take effect today because the county manager can put it into effect.
Oh, okay.
Okay. So we got a motion by Gabarski, second by Morgan to make the modified amendment. All in favor, signify by saying aye.
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 Those against signify by saying nay.
Nay.
So
Just to verify, so the yes is Grabarski, RP's Morgan, and the no's are Hickether and John. What was yours?
a no, yes, no.
Oh.
So the motion carries. So that amendment is made. Any other discussion?
We got to come back to that resolution.
Yep.
And
Okay.
just so you know, what we'll do, I'll help Cynthia with this, is we'll eliminate the language, anything that's not needed. It'll just say all unvaccinated employees are encouraged to wear masks effective today's date, pursuant to CDC guidelines.
Mhm.
And then we would include the sentence that all employees should be respectful of their coworkers' privacy. Fully vaccinated employees may choose to wear face coverings. Therefore, do not assume that somebody who is wearing a face covering has not been vaccinated. So we don't have that perception out there. And then the rest of the plan would remain in place as drafted.
Yeah. Okay, then we have the third amended resolution to implement COVID-19. We'll bring it back on the table. So we had a motion to approve and send that on the county board. Any other discussion on that? Okay. Seeing
Personally,
none,
I
all-
don't like.
What?
Personally, I don't like it to see it extended that far, but that's just my opinion.
Okay. Okay. All in favor, signify by saying aye.
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 Those against signify by saying nay.
Nay.
Okay.
Grabarski.
Okay. The motion carries. That resolution be taken on the county board. Since we have passed that and taken that to county board, as long as that passes, if it does, I don't think there's any need to take up the item C at this time. We'll move that to the next month's agenda. We can discuss that at then. So,
Okay.
Seeing nothing else on the agenda, I'll declare the meeting adjourned until, I think we set the date to be July 9th, correct? At 9 o'clock?
Mhm.
Okay. Okay. Thank you all.
All right. Thanks.
Okay. Bye.
Good day.